So loops is like we are comparing two scalar parameters with one another. It is either a pressure volume loop or a flow volume loop. So first is the pressure volume loop, which is again an important loop to understand. So the x-axis has the pressure and the y-axis has volume. So here you just keep increasing the pressure to see how much of volume is generated. Here you can see this is the PEEP, peak and positive end expiratory pressure. So that's why the graph is not starting from here. All ventilated patients will have a set PEEP. It is not 0. It is usually at a level of 5. We start the PEEP. So this graphs from a level of 5, assuming. So you keep on increasing the pressure. You see there is no change in volume at all initially. But after a particular point, you see there is a sudden increase in tidal volume. See, the graph goes up. The steep increases. This point is called the lower inflection point. So your main aim is to set the PEEP above the level of this lower inflection point, because for even a small change in pressure, even a little change in pressure, the tidal volume is increasing exponentially. So this is an important point which you have to remember in the PV loop. So this is again reflected in the slide. As you see this is again ideally it should not be in 0. This part should be like this, because we always set a PEEP for a ventilated patient. It cannot be seen like this. So this is an error in this graph. Okay, so you start your PEEP titration, and after a particular point, suppose this is a value of 10, you see the volume increases exponentially. This is called the lower inflection point, lip. You always want to set the PEEP above the lower inflection point. But after a particular point of time, this again starts flattening. So that is called upper inflection point. So once you suppose the lower inflection point is like 10 here, the upper inflection point is 20. Between 10 to 20, the lung is very good. So this is called as compliant portion of the lung. So what is compliance? Change in pressure per unit, change in volume per unit change in pressure. Suppose, see, even for a small change in pressure, you get a very good tidal volume. So that's what it indicates. So suppose above 20, suppose you set a pressure of 25, the curve starts again flattening again. So that is called over distension. So you don't want to go above the upper inflection point. You always want to keep above the lower inflection point. Below the lower inflection point, the alveoli start collapsing. So again, there will be not much response. So below the lower inflection point, it is collapse. Above the lower inflection point is the ideal PEEP to be kept. Again, this is again a volume graph. So you see the inspiratory volume reaches, suppose a value of 100 here. The expiratory volume is not coming to the baseline. You have a gap here. So because so much of volume is lost outside. So that is called leak. Always remember what parameters here. The volume parameters here, it becomes a leak. So it's an important graph to be noted. There are 3 pressure volume loops here. One is pink, green and yellow. You see here, suppose this is 10, 20 and 30 pressure and your tidal volume is 100. The first graph, yellow one, you have to give a pressure of 10 to get a tidal volume of 100. So which is very good compliance. But in the second graph, you need to give 20 of pressure to get a tidal volume of 100. So that means it is slightly little lesser. In the third, if you see, you'll have to give a pressure of 30 to get a compliance of 100. So this is a poorly compliant lung. So you need more pressure to get a particular tidal volume. So the pink will be a poorly compliant lung. The green is normal compliance. You give 20 of pressure to get a tidal volume of 100. Yellow is highly compliant lung, just like emphysematous lung where your compliance is very high. So in other words, to describe it, if the curve moves towards the right, if you draw a line from here, if the axis is more towards the right, that means it is a poorly compliant lung. Most of the patients, when you intubate them for pneumonia, the curve will be more towards the right. As they get better, the curve will start moving towards the left. So that is a sign of improvement. Always the trend is more important than a particular value. So next is, which is the least important one, is a flow volume loop. Again, this is the flow on the y-axis and the volume is on the x-axis. The inspiratory flow and this is the expiratory flow. So always remember, this is again a flow graphic. So always it has a negative deflection. So this is again the peak inspiratory flow, and here is a peak expiratory flow, and this is expiration. So your inspiratory flow reaches a particular volume, and again this same volume is not coming and reaching the baseline here. So that means some amount of volume is lost. This is again called leak. In the next graphic, you can see the inspiratory volume is going inside, but the expiration is taking longer time to reach the baseline. But it has reached the baseline. So that means no volume is lost here, just that the air is taking longer time to reach the baseline. So it creates a particular pressure inside the lungs. So that is again called auto PEEP or air trapping. So previous slide, you see the volume has not touched the baseline. So this is called leak. In the next slide, the volume has touched the baseline, but it has not come to zero. So that means there is some air which is trapped inside the lungs. So this is called auto PEEP. Always remember auto PEEP and air trapping difference. I mean, at air leak and air trapping difference. Here again you see the expiration is inspiration is this one. The expiration here you can see this is the normal. Black one is normal. It is little smaller. That means there is some problem in expiration, and it is sort of scooping. That means the patient is struggling to get the air out. So there is some expiratory airflow limitation, which is classically seen in diseases like asthma. This is a very common image which you can see in the ventilator. It will be even seen in flow time graph. If you have lot of serrations in the expiratory flow, it usually indicates there is some secretion or water in the circuit.